Hello, everyone. My name is April Rain, and I am so excited to welcome you to Healthcare Voters' new web series, What's at Stake, as we explore the pressing healthcare questions on your minds right now. Let me start by telling you about myself and why I decided to host this series. I'm a former attorney and current culture commentator, diversity and equity and inclusion expert. You might also remember me as the creator of the Oscar So White movement. Throughout my career, I've worked to center equity and justice in everything I do. And that's why I joined What's at Stake, because I believe that quality, affordable healthcare is a human right. We have seen the disparate impact that the lack of quality healthcare has, particularly in marginalized communities. As coronavirus takes its toll on millions of people worldwide, it is imperative that we have timely information based on science to help us combat the virus itself and the misinformation surrounding it. The coronavirus pandemic has permanently altered national conversation about healthcare in the United States. We're facing a right-wing lawsuit that threatens to dismantle the Affordable Care Act, the ACA, in the middle of a pandemic. Pharmaceutical megacorporations are profiting off of the taxpayer-funded hunt for a vaccine. We continue to fight legal battles against gender identity-based discrimination in healthcare. Intergenerational families are navigating health challenges like never before. Though I'm only scratching the surface, I know the American people are looking for answers to these and the endless healthcare challenges facing our country. So, starting today, I'll be hosting Healthcare Voters' 5-episode web series featuring conversations with experts, patient advocates, coronavirus survivors, celebrities, and lawmakers as we find the answers to pressing questions about what's at stake for America's healthcare right now. Today's episode is the first in the series, and we'll be discussing one of the most important and under-discussed issues of healthcare, Medicaid. Medicaid is a life-saving health insurance program, and it provides coverage for nearly 75 million low-income people, children, their parents, seniors, and people with disabilities. Since 2014, the Affordable Care Act has paved the way for state-by-state Medicaid expansion, which has saved countless lives in the 39 states, including Washington, D.C., that have since adopted the expansion. In fact, Missouri recently became the newest state to expand its Medicaid program under the ACA, announcing the expansion in early August of this year. However, 12 states, including North Carolina, have still refused to expand Medicaid, and several other states have instituted prohibitive policies to gatekeep more than 2 million low-income people from the crucial access to healthcare provided by Medicaid. So today, we'll hear from advocates, experts, and lawmakers about what's at stake for people in states that have not expanded Medicaid, and look at the disparity in healthcare compared to states that have expanded the program. We've got a great lineup of speakers joining us today. I'm excited to introduce you all to Senator Bob Casey from Pennsylvania, Andy Slavitt, the former acting administrator of the Centers for Medicare and Medicaid Services and the host of In the Bubble, Kelly Hall, the Director of Health Policy and Partnerships at the Fairness Project, Anton Gunn, the former Director of External Affairs for the United States Department of Health and Human Services under the Obama administration, Carrie McBain, a healthcare advocate in Sylvan, North Carolina, and Milkaela Allen, an electoral justice organizer for Action St. Louis. First, we'll hear from Senator Bob Casey from Pennsylvania about what the fight for Medicaid expansion looked like in Congress back in 2010 and what's at stake from his perspective today. Thank you, Senator Casey, for joining us.
Well, April, thank you very much for this opportunity. I want to thank you and the others who are on the call, so many of whom have been laboring in this vineyard a long time. And I'm not just saying about Andy because I've known him a while, but so many others who have worked so hard to bring healthcare to people through the Medicaid program, to expand it, to improve it, and to validate it. I think we got a good reminder, or even for some Americans, a reintroduction to the Medicaid program in 2017 when repeal was kind of marching forward, and we came very close to having the Patient Protection and Affordable Care Act overturned, or repealed, I should say. I think it gave people an appreciation for Medicaid. And in so many ways, I think Medicaid tells us who we are, or who we should be as Americans. It provides health care to some 75 million people. And it's basically about three groups of Americans. It's about children, it's about seniors, and it's about people with disabilities, and a lot of them being children. And once the American people focused more intensively on that, I think that was one of the reasons why we were able to defeat the repeal effort. But we still have a lot of battles ahead on Medicaid because there are two challenges, at least legislative challenges. One is to make sure that it's not underfunded over time. And you've got an entire political party now, the Republicans, where the official position of their party is to cut Medicaid by several $100 billion over 10 years. Now, I know that they didn't have that in a party platform because they didn't have one this year, but you don't need to find the party platform to know that they have supported categorically as a party year after year cuts to Medicaid that amount to several $100 billion each and every year for 10 years, or several $100 billion over the course of 10 years, which would mean that Medicaid under that Republican approach would be cut by 50 billion or 60 billion or 70 billion or higher each and every year for 10 years. And we have to use every fiber of our being to stop that from happening. But that doesn't even get you to the next part, which is, of course, expansion. In April, as you noted, 15 million Americans, more than 700,000, by the way, in Pennsylvania. So roughly 700,000 of our 1 million who got coverage in the Affordable Care Act got it through Medicaid expansion. And that's true of a lot of states where the lion's share of the coverage was in Medicaid expansion. But the Republican Party has another official position. They don't want to just cut the Medicaid program over time. They want to eliminate, because that's what the lawsuit in front of the Supreme Court would do. It would eliminate the entire Medicaid expansion effort that was undertaken in that act. It would wipe out coverage for all those 700,000 or so in Pennsylvania and up to 15 million nationally. So that's what we're up against. And this is a party that is determined in their efforts to cut Medicaid and to end Medicaid expansion. So what should we do in the face of that? Well, in the middle of a pandemic, we should continue to push legislation that I and others in the Democratic caucus and the Senate have pushed to provide more opportunities to use Medicaid as a vehicle to cover people who have COVID-19 and to get them the treatment they need. I have other ideas about using Medicaid to expand coverage to children and to others. But one thing we should do, and I'll end with this, is pass a bill like this, 4108. I just happen to be the prime sponsor of it. But this bill is the exact title of the bill. I think the number is more important because you can find it, 4108. But the Coronavirus Medical Response Act, really simple. In minds much more experienced and smarter than mine, came up with this proposal in various versions over many years. And Andy and some others on the call know what I'm talking about. But it's basically an effort to tie the federal matching rate, the so-called FMAP percentage, to a state's unemployment rate, like we are now. Like, for example, in Pennsylvania, we have an unemployment rate in the month of July of 13.7%. 886,000 people are out of work in our state. And it's not just cities, it's suburban communities, it's small towns, it's rural areas. And when you have that kind of a jobs crisis, the trauma that comes with an economic crisis, you ought to be able to rely upon an increase in the matching rate. But that's not likely to happen through any legislative process right now because Republicans are against it in the Senate. So it would be better for the long term, especially for the next economic downturn, to have something in place which would automatically increase the matching rate. So that's what we're going to try to do with this bill. And it's one way, I think, to keep our promise to people in this country that when When our country has a downturn, we help people. We extend the hand of support to them. One of the best ways to do that is to use Medicaid as a safety net, even more so than it is generally, to help people who are unemployed, to help people who have lost their health insurance. So a lot more to talk about, but that's one big idea that we're pushing.
Thank you, Senator Casey, for sharing that timely and important context. I know a lot of our viewers are wondering, during this pandemic, what difference do you think expanded Medicaid programs have made in states that chose to expand under the ACA versus states that refuse to expand Medicaid?
April, I'd say the word that comes to mind is incalculable. It is almost impossible to calculate the benefit of Medicaid expansion with regard to people's lives, because it's almost impossible to describe. But the good news is folks have studied it, and we know that all kinds of healthcare challenges and traumas that a lot of families suffer through are greatly benefited by having the coverage of Medicaid. We know, for example, that if a child has Medicaid, that they're going to get access to early screening, periodic testing, and all kinds of preventative care they wouldn't have otherwise, and sometimes don't even get in. That's just a fact when it comes to children. But in terms of the expansion, we know that a lot of the studies indicate that all kinds of health outcomes have been improved. I'll give you one example in a state like ours, and I know this is the case in many other states. Just as Medicaid expansion was landing, so to speak, was being implemented and people were benefiting from the coverage, what was happening? One of the things that was happening was the substance use disorder crisis was hitting at the same time, the opioid crisis, which was hitting small towns and rural areas. There were tens of thousands, and at one point I had a number that I think hovered around 70,000, but at a minimum in Pennsylvania, tens of thousands of people were getting treatment for a substance use disorder problem solely because they had Medicaid through Medicaid expansion. So that alone mitigated that trauma. That alone was I hope for so many families, a break in the fall when a family member was suffering from some kind of substance use disorder. So Medicaid expansion has already benefited so many, and we've got to fight to continue it and fight to expand it to those states that have not expanded. Missouri doing it is a big breakthrough, I think.
Thank you so much, Senator Casey, for joining us today and providing information on 4108, something that we'll be able to track as hopefully it moves through the legislative process.
Thank you.
Thank you for joining us. And to all of our viewers watching, thank you for joining us as well. We want to hear from you. Feel free to drop a question below this video for any of our speakers today. For the next segment of our show today, we'll talk with two experts from the Obama administration about why Medicaid expansion has meant the difference between life and death for so many Americans. I'm thrilled to welcome Andy Slavitt and Anton Gunn to the show. Anton Gunn is the former Director of External Affairs for the Department of Health and Human Services, where he played an integral role in the implementation of the Affordable Care Act, the ACA. Following his tenure in the Obama administration, he was a resident fellow at the Institute of Politics at Harvard University. Anton previously served as a state representative for District 79 in South Carolina, and now is an international speaker and consultant working with healthcare organizations to build a world-class workplace culture. Andy Slavitt served as the acting administrator for the Centers for Medicare and Medicaid Services under President Obama from 2015 to 2017. Prior to that, Andy oversaw the successful turnaround of healthcare.gov and served as a group EVP of Optum. Andy is currently board chair of United States of Care and the founder and general partner of Town Hall Ventures. He also hosts a podcast called In the Bubble. Thank you, Anton and Andy, for joining us today. I want to start by asking you a question a lot of our viewers have been asking. Most people hear Medicaid and think it only applies to adults with limited income, but that's actually not entirely true. Can you both talk our viewers through who all benefits from Medicaid expansion? I'll throw it to Anton first.
Yeah. So first of all, thank you for this opportunity. I think this is a really important conversation, and there is a lot at stake in America. So I want to talk about Medicaid being a benefit to so many different types of people. So I'll give you an example of a young lady that I literally talked to last week. She works part-time at Target. She makes about $13,000 a year working part-time at Target. When she's not working at Target, she's driving an Uber or doing DoorDash, if you will. And so her income is about $17,000 or $18,000 a year. And she's going to school part-time at Technical College, really trying to further her education. Well, right now under South Carolina law, she is uninsured because she doesn't qualify for Medicaid in our state because South Carolina is a state that didn't expand. So we're talking young people, students who are trying to further themselves in their career to create an opportunity. She's not in a position where her parents can put her on coverage because she has just aged out of it. And so she's 27. So my context is these are real people and real lives. I'll give you another example. There are actually some military members, former members of the military who served our country, but didn't serve long enough and are not eligible for VA benefits that would be eligible in states that expanded Medicaid. And let me not forget the numbers of men and women who are now coming out of our jails and prison because they're being released early, because they finished and served their time in states that did not expand Medicaid. They are not eligible. And in all three of these circumstances that I described, there's a disproportionate number of them that are Black and brown that are not getting the access to quality, affordable healthcare that they deserve because their states didn't expand Medicaid. But in other states that did expand it, they now have coverage.
Thank you for that. It really expands the universe of who we're talking about with respect to Medicaid and how important expansion is. Andy, could you share with us some more examples of who all benefits from Medicaid expansion?
Sure will. And April, thank you for the example you set. This is a time when we all need to be so very involved in the political process and in the process of getting justice for people. Anton, pleasure to be on here this panel with you. You know, I think it's important to understand that most of the jobs that are being created these days for young people are places like Amazon. There are places where people work 29 hours. They are people who, in normal circumstances, you would expect, oh, they would get health insurance coverage. Walmart, Amazon, all of these places, they engineer their employment policies so that many people do not get Medicaid. And in fact, they count on the fact that Medicaid will put the bill for them and provide this medical coverage. And in states that have not expanded, like South Carolina, that's just not happening. So this is not the safety net program that it once was. This is a program that people use to basically lead their lives. Pregnant moms, low-income pregnant moms. Who wants a mother not to have access to healthcare when she's pregnant? Who wants an expectant mother? Who's going to look me in the eye, look any of us in the eye and say, no, we ought to take away that coverage? People with disabilities that are under 65. Who's going to sit here and say that people who have the misfortune and have overcome so many different things that a lot of us don't have to, and a lot of us don't even realize, shouldn't have access to the best quality medical care? Who should say that that's what our country is all about? This is what Medicaid expansion attempted to and very successfully addressed. I'll just speak one more thing. You know, there's a lot of opinions in the world, some of them right, some of them wrong. But Medicaid expansion, once it was around for 5 years, we were able to move from opinion to fact, because you could look back and say, what happened? So since Medicaid expansion, let me just give you a little bit of a picture of what happened. We have reduced the disparity in cancer care from Black and brown communities to white communities. We reduced the disparity in cardiac care almost entirely for people who expanded Medicaid to people compared to communities that did not expand Medicaid. We reduced maternal mortality. We reduced infant mortality. We increased home ownership. We decreased foreclosures. We decreased payday lending. All of these are just comparing states that expanded Medicaid to states that did not. Budgets became healthier in states. Hospitals reduced the amount of bad debt they had. This was good for everybody, for every state that expanded Medicaid. 5 years demonstrated evidence.
Yeah,
Thank you for that, Andy. Go ahead, Anton.
Yeah, I just want to add, and you're so right, Andy, that, in states like Wisconsin that expanded Medicaid, and we all have been paying attention to Wisconsin for the last few weeks, and my hearts and prayers go out to all of the families there, particularly the Blake family. The state of Wisconsin, was able to reap so much revenue as a state because they now have more people covered. You got more people who are productive, who are working, who are paying taxes because they have a foundation underneath them. Everybody knows that without your health, if you're not healthy in your mind, you're not healthy in your body, if your community is not healthy, you can't live out your God-given potential. And so this becomes a benefit. This is a part of the whole construct of life, liberty, and the pursuit of happiness. You can't pursue happiness if you don't have strong, healthy lives. And Medicaid is a great foundation for that. And in the states that expanded it, they're creating those opportunities. This is what is giving people life. But in the states in the deep South, like South Carolina, North Carolina, Georgia, Florida, et cetera, that didn't expand Medicaid, we're literally putting people's lives at risk every day and more at risk because these are the states where the coronavirus is off the charts. On top of that, we know even before COVID that there were some 10,000 people a year who were dying that otherwise would have been alive if they were able to access Medicaid for preventive screenings, for be able to get basic treatment that they need for small diseases that got exacerbated because they went so long and didn't get care because they couldn't afford it because they didn't have coverage.
Thank you for that, both of you. And I want to take the opportunity while I have two experts to really drill down into specific questions. In states where Medicaid was not expanded, many would-be eligible adults fall into a coverage gap that puts health insurance out of reach, as you all both discussed. They don't receive financial assistance, but are ineligible for Medicaid, so they can't afford coverage. And the coverage gap means that roughly 2 million people are missing out on coverage they would otherwise receive. Andy, I'm going to go to you first because this sort of builds on what you were saying before. How do we close the coverage gap? Is state expansion the only way forward, or are there other options?
Yeah, state expansion or Congress, which from our perspective, from all your perspective, means advocacy. It means letting people know this is important. As Senator Casey said, we let people know in 2018 how important this was, and it paid off. It paid off in stopping the ACA from being repealed in 2017, and it paid off in putting people who believed in protecting and expanding access to healthcare in office in 2018. So I know there's a lot going on. I know there's a lot of issues. I know there's a lot of things we care about. Many of them are equally important. Some of them are distractions. But if we don't advocate for people, then it is not going to get fixed. And there is no better time to advocate for them than now. I will tell you that if you are a mom with kids who is not getting access to the healthcare you need because the laws are working against you, she doesn't have time to write 40 letters to 40 Congress people. She doesn't have time to go to the Hill. She doesn't have the luxury of being as active as she might want to be. She will be later, but we need to get her the basic healthcare, as Anton said, that allows her to lift herself up. So in the meantime, that should double and triple our burden. We need to carry that burden because until that happens, we're not going to live in the kind of country that does things the right way, the way we need it to. So it is one of those problems that you described, this coverage gap. It's not a problem without a solution. It happens to be a problem with an obvious solution. It's an obvious solution. It's solved one of two ways, either solved the way Missouri just solved it, the way it's being solved by the states that are deciding to expand Medicaid. And guess what? It's good for the state. The federal government picks up 90% of the tab. Or it's solved by telling Congress, do your job, stop leaving people in the lurch, and make sure that people are getting the health care they need. Both of those things are possible, but they're not possible we don't do our work in the next couple of months.
Yeah, I'll add on to that. April, Andy, I really fundamentally believe that this comes down to one word, and that word is leadership. Everything rises and falls on leadership. The states that have not expanded Medicaid have not demonstrated that they have leaders who are committed and authentic to making things right for the people in their states. I live in the state of South Carolina. There's some 297,000 people who would have health coverage today had our governor and our legislature expanded Medicaid. And because they chose not to do so, they've left 300,000 citizens in a lurch that we've talked about, in a place where they don't know what tomorrow may bring. A car accident, the coronavirus, any kind of thing could literally take them out of here or take them out of here financially. Either way, it's bad. And it comes down to leadership. Do you want to have leaders who are willing to do what's right and make things right at the state level to get it done? And again, Andy is 100% right. If the states can't do it, then the Congress has to get its act together. Particularly the Senate has to get its act together to support our ability to make sure that every American has the opportunity to be made whole, to be able to have a foundation underneath them so they can do the things that they need to do to grow themselves, to start their own businesses, to build an opportunity for their future to be bright in this country. And it really comes down to leaders who are willing to do the right thing. And if leaders haven't shown the intestinal fortitude, the willingness to make it right for the people they lead, this is where people power come in. This is why I am a member of Healthcare Voter. This is why I'm a board member, why I'm involved, is because we got to show up on election day, and we got to show up every day after the election to make sure that our leaders do what we have said and what we've asked them to do. There's no time for playing or sitting on the sidelines. Everything is at stake right now, not just Medicaid, but all of our future is at stake by what we do in this election, but more importantly, what we do every day after the election. So mobilize, organize, get in a grassroots mode, talk to your local leaders around their positions on this issue of Medicaid, and do they care about the people that they lead? Because I believe a leader who cares will always help, and a leader who helps is a leader that can be trusted. And the question is, do you trust the leaders in your state?
Thank you, Anton and Andy, so much for joining us today. I think you're exactly right, that we have a crisis of leadership. And so it falls on us as American citizens to take up that mantle and fight for what we believe in. I'm sure our viewers would agree with me that your insight and longtime commitment to expanding access to quality healthcare for the American people is hugely important, especially now. Thank you again. And to all our viewers, if you have any questions for our panelists today, remember to feel free to drop them in the comments of this video. We want to hear from you, and please share, like, and retweet this live stream to spread the word. Next, we're going to hear from 3 amazing women about their perspectives on state Medicaid expansion, especially as we navigate the impact of the COVID-19 pandemic on already marginalized communities. I'm excited to introduce you all to Kelly Hall, Michaela Allen, and Carrie McBain. Kelly Hall is the Director of Health Policy and Partnerships at the Fairness Project, a nonprofit incubator and funder of ballot initiatives that empower working families. In her role with the Fairness Project, Kelly has helped to draft and pass the Medicaid expansion ballot measures that have passed in 6 states in the past 3 years: Idaho, Maine, Missouri that we discussed earlier, Nebraska, Oklahoma, and Utah. Kelly worked on Capitol Hill during the drafting and passage of the Affordable Care Act, and then served in President Obama's administration in both the CMS Innovation Center and the HHS Office of Health Reform, helping to implement the law. Michaela Allen is a Black organizer in St. Louis. They serve as the Electoral Justice Organizer for Action St. Louis, a grassroots racial justice organization. They work on campaigns that build Black political power in the region. And Carrie McBain is from Sylva, North Carolina. She's a former community organizer with Down Home, North Carolina, which fights for low-income families and is currently working as a census taker, which is incredibly important this year. If you haven't filled out your census forms, please do so right away. Carrie has struggled to afford healthcare without health insurance, and she is one of the many thousands of Americans who falls in the Medicaid gap. Thank you, Michaela, Kelly, and Carrie for joining us today. And my first question for you all, and Michaela, I'll come to you first. What's at stake for you personally during this pandemic, especially given your work to hold states accountable to expanding Medicaid in recent years? Michaela?
Thank you. And thank you so much for having me here. It's a pleasure to be on here and get to talk about this. So first, I want to say for the past year, I've been organizing around Medicaid expansion, which became Amendment 2 on the ballot in Missouri this past August. And so when we talk about what is at stake for myself personally, I think about what is, honestly, I think about what is at stake for the people that we serve and the communities that we serve. And so honestly, I mean, whole communities are at stake here. Specifically where I am in St. Louis, Black communities are at stake. St. Louis City, you know, has released data that has shown the highest concentrations of COVID-19 cases are on the north side and predominantly Black neighborhoods. In St. Louis County, right up the road, zip codes like Ferguson and Jennings, which are 90% Black, are facing the same thing. And yet, you know, testing sites popped up first in predominantly white areas like West County and in Chesterfield. And so it's clear to me that our communities are bearing the brunt of the virus. And so the need for adequate healthcare coverage was and is monumental for us.
Absolutely. Thank you for that. Kelly, I'm going to turn to you. Can you tell me how and what's at stake for you personally during the pandemic?
Again, I'll echo everyone in my appreciation for being involved in this conversation and for elevating this issue. My work is centered around using ballot measures to advance this issue. As you mentioned, April, we've been able to achieve Medicaid expansion in states where leadership has failed, as Anton was describing, where state legislators are unwilling to expand. They continue to be unwilling to expand Medicaid. We've been able to work with coalitions of groups on the ground to advance Medicaid expansion in Missouri, in Oklahoma, in a whole bunch of otherwise red states. And that's really about taking power back to the people and saying we're unwilling to let ideology and intransigence in legislatures hold us back. And so we thought we were going to have Medicaid expansion on the ballot this November in Missouri and Oklahoma. It ended up, we went on the Republican primary days and we still won. Thanks to Michaela's extraordinary advocacy and organizing and a whole bunch of her collaborators in Missouri and peers and counterparts in Oklahoma. So to me, I wish that we were able to elect a slate of legislators at the state level to make this unnecessary for us to do these ballot measures and go around legislatures. And we can't do ballot measures on Medicaid everywhere. So in places like North Carolina, what's at stake for me is that, you know, we can't go into every state with this strategy. And so we really need voters in North Carolina and South Carolina and Georgia and elsewhere to elevate those elected representatives who can expand Medicaid through that pathway as well.
Thank you. Carrie, you don't have health insurance now, and you literally fall in the Medicaid gap. So tell us what's at stake for you personally during the pandemic, especially given your work to hold states accountable to expand Medicaid.
Sure. Thank you so much for allowing me to share my story. I'd have to say the last couple years of my life have been a struggle. I've experienced pain and joy throughout all of this. I'd say what's at stake for me is, for one, to make sure that I can continue to access medication assistance. And also, you know, and that's not guaranteed either. Just so you folks know, if you're on medication assistance, it does not have to last, depending on your circumstances, depending on your finances. But because I do have medication assistance, I'm so thankful for that. But the other thing that's at stake is watching my community suffer. And I have friends and family that are suffering without healthcare coverage. And I feel like I'm fairly new to this work, even though I think my former comrades in arms at Down Home would say I'm not a newbie anymore. I still feel like I'm very new to this space, but I feel like I'm supposed to be here. I feel that I'm supposed to share my story so that I can help uplift and encourage other residents in Silva, where I live, to step forward and say, this is not okay. So I feel like my part is to help others and share my story, whether it's painful or not, and let them know that you are not alone. You know, take my hand, take your neighbor's hand. Let's pull each other into the same safe, loving space we all deserve to have.
Thank you so much for that, Carrie, and the three of you for your strength and your commitment to this issue. We have a question from Bonnie on Facebook. Bonnie asked, I want to share this with the three of you, for states that have not expanded Medicaid, how will those states cover the costs associated with COVID-19? Who would like to tackle that one?
I mean, I'm happy to take a stab at it. And the answer is unclear to all of us. It has always been irrational for states to make the choice not to expand. The federal government in the initial years picked up 100% of the cost. Now it's 90% of the cost, and it will be in perpetuity. In many states, Missouri included, the cost savings that accrue to the state by doing this more than offset the cost of expansion. And so it has always been an incredibly rational and fiscally responsible choice for states to expand, in addition to being the human thing to do, the sort of human kindness thing to do. And so for states who have not yet expanded, who are now facing a pandemic that is further endangering their state budgets and is threatening or taking the lives of tens of thousands of their residents, to continue to make the irrational choice to focus on ideology about some nonsense idea of smaller government or attachment to an idea that this is Obamacare or just straight racism. I think that we really need to be aware that it is purely irrational to continue to make that choice not to expand, and how they're going to cover the needs of their population in this time of acute crisis. It is unfathomable. The answer is they're not going to. They're going to leave a lot of people behind, and a lot of people are going to suffer. So I don't have a good answer, but I think that's why this conversation is so important to be having.
Thank you for that. And it's scary to be very transparent that we don't have clear solutions here. We do have another question from Denise on Facebook. Carrie, I'm going to throw this one to you. Denise asks, what states have expanded Medicaid? And we know that 39 states have, including Washington, D.C., that have expanded Medicaid. And Missouri is the most recent state to expand. And there are states like North Carolina that have not yet expanded. We have two wonderful experts to talk to us about those states today. And so, Carrie, if it's okay with you, I'd like to hand things over to you first to talk about what's at stake for North Carolina, where you are, in the next year related to Medicaid expansion.
Absolutely, and thank you. I actually cannot name all the states that have expanded Medicaid, but I can tell you there are 12 states that still have not, including my own home state of North Carolina. My personal belief, I absolutely believe that it is sanctioned murder to knowingly allow your constituents to die when there is a very easy solution to giving them access to affordable health care, to preventative health care, to regular checkups and routines. This is how people get through their lives when they're healthy. They go to work, they're able to find babysitters for their children, or they're able to pay for them. There are all these things that are so critical to passing Medicaid expansion. It's not, I know that there's a stigma attached to people that don't have healthcare coverage. I am one of them. I have been in the Medicaid gap for a very long time. And what's at stake is that we want legislators in office that if they are not willing to use their heads, their hearts, and their guts when making decisions and not just what makes sense up here. We don't want them in office. We would like people in office that are willing to show their compassion to their constituents. This is so easy. In Jackson County alone, where I live, over 2,000 people would have access to healthcare coverage if they would just say yes. It is so easy. I don't know how else to say this. And I'm a layperson. I am not an expert, but I know this from the work that I have done and from the pain and suffering I have gone through and watched my friends and family and my community residents do the same thing. So what's at stake is making sure our community here in Silva and in Jackson County and all over the 7 westerly counties that are severely neglected, we want to see us thrive and not survive. That's what this is about. That's what's at stake.
Absolutely. Thriving and not just surviving. I love that. Milkaela, I'd like to kick it over to you to talk about a little bit of good news about the recent victory of expansion in Missouri.
Yeah, absolutely. Yeah. So on August 4th, we passed Amendment 2, and doing that, we were able to provide access to healthcare to over 230,000 folks who are uninsured. And that's massive. Like I said, when we talk about what's at stake, we're talking about hundreds of thousands of people's lives, whole communities that are at stake. And with job security fluctuating the way that it is, that number could be so much bigger now in terms of the people who could be affected by Medicaid expansion. There are 500,000 uninsured Missourians, so the potential to change lives simply by meeting an individual and a family's basic needs in this way is huge. And it's essential to ensuring that surviving this pandemic and that receiving care and living a life where you can thrive in a healthy way doesn't depend on how much money is in your pocket. And so actually what was really interesting about Missouri and our fight to expand Medicaid was that the understanding, especially in the Black communities that we serve, was so deep. The urgency and the connection to the issue was clear. Oftentimes when you collect signatures for a petition or when you're in the phase of knocking doors or on the phones, you have to start from square one talking about your issue. But Black folks, especially here, had an understanding of the issue of Medicaid expansion and its history. I talked to a couple at an event and they would absolutely light up like, yes, this is so long overdue. I'm so glad to see you working on this. My own parents said the same thing to me, that this was such an important issue that we needed as a state. And several folks who volunteered to gather signatures with us had been impacted themselves by not having Medicaid. Some people have lost friends and family members to this. So it's deeply rooted, it's urgent, it's personal. And while I was newer to organizing around this campaign, folks who I work with have been talking about organizing and advocating for Medicaid expansion for almost a decade. That's how long-standing and deep the healthcare crisis we face as a state is, long before COVID-19 even entered the arena and made things that much more dire. And so that's because for the past decade, like in other states, our state legislature has ignored us. And it was said before by Anton, what is lacking in the states that have not expanded Medicaid yet is leadership that values centering this issue and that values protecting our lives in this way. So we watched them for the past decade drag their feet through the mud while countless lives have been lost and derailed from not having access to healthcare. And we pretty much decided that that was enough since our elected officials had failed for so long to protect our families. The voters took this issue into their own hands and really saw it through. From signing the petition back in June to now getting to be on the ballot in August, we really did that.
You did do that. And I want to congratulate you for your hard work on the ground and getting Medicaid expanded in your state. And we've got a lot of great questions coming in. I want to see if we can get to a few more. Yolanda from Facebook asks, who is giving the state this authority to decide this? Yolanda, that's a great question. And it really gets at the history of how the Affordable Care Act paved the way for states to expand Medicaid in early 2010. Kelly, if it's all right with you, I'll hand things over to you to talk about how state expansion came to be.
Sure. So there's sort of a two-part history to this answer. One is what was originally imagined in the Affordable Care Act when it was passed. And when Congress passed that law back in 2010, all states were supposed to expand Medicaid up to 133% of the federal poverty level, which now is about $18,000 a year for an individual. And beyond that, you were supposed to be able to get subsidized coverage through healthcare.gov or state-based exchanges. Then a Supreme Court ruling that was meant to challenge the entire Affordable Care Act, which did not succeed, did have the effect of saying that requiring states to expand Medicaid was not allowed, and that this expansion, even with a really good financial deal for states, had to be optional. So a whole host of states expanded right away. And that started in January of 2014. But it's really the combination of the Affordable Care Act passing and the Supreme Court ruling that left the option up to states. And so now it's been a slow trickle of states slowly making the decision to expand. And in the past 3 years, with the exception of Virginia, which flipped their legislature to Democratic control and expanded in 2018, all the other expansion states have been through ballot measures. It's been Maine, Utah, Idaho, Nebraska, Missouri, Oklahoma. And this is what we at the Fairness Project have been doing with most of our time, is helping to fund and facilitate these coalitions. And we hope that the next slate of states, we've got 3 more to go that can do it this way: South Dakota, Mississippi, and Florida. If you're out there, we're looking at you. We want to be in touch. But it really has meant that the option is up to state legislatures and governors, but in those states who have a ballot measure process, people like Milkela and their colleagues have taken the issue back into the hands of voters and said, enough is enough. We're not waiting for you anymore at the legislature. And they've adopted that option given to them by Obamacare, the ACA, and the Supreme Court on their own to do it through ballot initiatives.
Thank you for that important context. We've got another question from Bonnie on Facebook. Bonnie, you've got some great questions. Keep them coming. Bonnie asked early, and those like Missouri who expanded it later. Who'd like to tackle that one?
I can. I'm happy to turn it over to Carrie or Milkela also. The answer is barely any difference. If a state chose to adopt it right away, there was more federal funding. It was 100% federal funding in the first couple of years. No matter when you've adopted the Medicaid expansion, now in 2020, it's a 90% federal match. And moving forward, it's a 90% federal match. And so states who adopt it right now, like Missouri, are in the same boat as California and New York, and will be in the same boat as Mississippi and Florida and South Dakota and North Carolina when they adopt it. So at this point, there's not any real difference.
Thank you for that. And Carrie, I really want to appreciate you sharing your story today. You mentioned that there is stigma about not having health insurance, and I know it takes a lot of courage to speak out and put your name and your face to this issue. What would you say to our viewers today about the importance of storytelling?
So thank you for that question. That's actually a very interesting one, and one that I probably would not have answered ever years ago, at least 2 years ago. Now, I'd say relaying my story, I am someone that leads by their emotions. So I feel everything, besides for myself, with those that I love. And so until I went through the horribly demeaning process of giving money to specialists who gave me about 5 minutes of their time and then said, "Oh, I'm sorry, honey, I can't help you. Let me refer you to another specialist," and another $550 went to the wayside. When I didn't have that money, I was borrowing money from my family or taking money, robbing Peter to pay Paul, as they say, so taking out of my bill money. I never knew that that kind of process was actually possible because I didn't have healthcare problems until a couple years ago. So basically, all at once, all my organs started to fail. My eyesight, my hair, it was horrendous. And I would never, ever want anyone to experience that. But the process of going through that and trying to get help, I, like many people, thousands upon thousands of people, I was relying on the emergency room for regular routine care, which I don't mean I was in there every day. I mean, whatever was happening, I couldn't afford to see a regular doctor. I only went when I had to. If I couldn't help manage my own pain or I didn't know what was happening. And so I racked up thousands of dollars of bills. Well, if you've ever had that happen, you know that creditors call. Creditors call and they threaten and they make you feel like the worst person in the world. And as I'm struggling to maybe send them $25 so they'll stop calling me, then I'm in doctors, your specialist office that don't care and only look at me for 5 minutes and then pass me off to somebody else like I'm a nothing. All of that, including 6 months of struggling for life-saving medication, I wouldn't wish it on my worst enemy. And all of that has shown me that really, truly, unless you have gone through some of the same or similar suffering or pain or angst around healthcare and all of that contributes to that, it's really hard to understand. So the stigmas attached to it, they're really difficult. I've heard, well, get another job. I've heard move to another town. I've heard stop wasting your money, things like that. And it was, I had to stop working full time at some point a couple of years ago when I was a server for 13 years locally. I couldn't do it anymore physically, but I didn't know what was wrong and nobody would help me except for my local Blue Ridge Healthcare Clinic, which is a federally qualified healthcare center, which I'm so thankful for. My first visit with them was 3 hours long. And as I cried with some of the staff there, because I was so, I even hate to say it, I was so thankful and happy that someone was listening to me, listening to what I was saying to them. I said to them, I would stay with you 6 hours if that's what you asked me to do, because you were the only people that didn't treat me like I was nothing. I am not nothing. My family, my friends, you in the audience, anybody out there, you are not nothing. And so I will not stand by anymore and allow legislators to take advantage of people who don't know what's happening, who don't know the system, have never experienced it. And if that's what my story helps to do with people, I'm good with that.
Thank you so much, Carrie. I don't have the words. Thank you for being a storyteller. I'm so thankful that you are here with us to share your story because it is a story of millions of Americans in this country. Having a primary care physician is a privilege that not everyone can have. I want to share a comment we received on Facebook from Shelley, who said, "We need to say out loud that the decision to not expand Medicaid is based in racism." And I'm curious if we could quickly, Michaela, if you could just speak to that just for a moment as we wrap up.
Yeah, absolutely. Like I was saying before, we understood that how deeply connected this fight was to our community, and like it's been said before, especially in a state like Missouri, where folks like to equate Medicaid and the ACA with Obama and just make racist connections. And use that as an excuse not to support a policy that would protect so many people, I think is really at the root of this. I definitely agree that there's so much racism and inequality that is at the root of this issue, and which is why I'm forever grateful that the coalition of folks that I worked with that helped see this work through were very clear that we have to approach this with a race forward messaging because it was clear how people would try to turn this. And even, you know, some of the mailers that we saw coming out, you know, those Saturday mailers coming out were extremely targeted, you know, extremely targeted to Brown communities, to immigrants across Missouri. We definitely saw a lot of hatred coming out around that.
Absolutely. Thank you all, Carrie, Kelly, and Michaela. Thank you so much for your time and expertise today. I know I've learned a lot from your insight and clearly from the questions that we've received. Expertise today. I know I've learned a lot from your insight and clearly from the questions that we've received that our viewers have as well. So, well, folks, there we have it. With lower income Americans already facing coverage gaps, health disparities, and disproportionately difficult paths to quality health care, the COVID-19 pandemic has made it crystal clear. We need to expand Medicaid in every state across this country, and organizations like the Fairness Project are making sure that Medicaid is on the ballot. Next week, join me for an Instagram Live conversation with Anushka from Healthcare Voter, where we'll discuss how Medicaid expansion benefits Black and Brown Americans and how states' refusal to expand Medicaid disproportionately hurts Black and Brown Americans too. Head on over to Instagram to follow Healthcare Voter, all one word, to stay tuned for more information. Healthcare in the United States will forever be changed by this pandemic. Keep tuning in every week to What's at Stake to be part of the new conversation. I'm April Rain, and I'll see you soon.